Hey guys, what's going on? I thought I'd make a little vlog. So at the moment, I'm on my rheumatology placement, which is one of the blocks I chose this year. And now I'm going to a regional training day, which should be interesting. I've never been to one of these. Just for some context, this was a training day for renal and rheumatology registrars. So medical students with those departments were invited, like me. The conference was held in a place called Newmarket, which is famous for its racing scene, hence all the horses. Lunch was great too, as I suspect it was sponsored by one of the pharma companies who had come to sell their latest monoclonal antibodies to us. What have you learned from the conference? Are you enjoying it?
Yeah, the conference is banging. Really good conference. Learned a lot. Shout out to Dr. Saad Ahmed, the best rheumatologist there is.
Hi guys, we're midway through the rheumatology training day. We were split into groups, so I am in the T cell group, which is the yellow wristband, and there was also a B cell group. And we essentially had a few talks, a few case presentations, and also a couple of games, which are essentially quizzes about some of the teaching. So one was on innate and one was on adapt immunity, and it's been pretty good. And there's also a nice free lunch, which is cool. So I only got one, but because he won, he got
A cupcake.
a T cell and an antibody cookie.
Chris is a smooth talker, you know.
Fresh, what did you feel about that event? What did you learn?
So what I learned was the new antibody. No, what was it? A new drug called FGAR something, which
The anti-FCR.
the anti-FCR drug, which essentially cleaves off the FC portion of B cell.
Future rheumatologist.
That's future dermatologist.
After driving back, I had dinner with some friends from church. How are you feeling?
Bro, I'm so well.
I like your
My
apron, yes. It's looking like a tasty meal being cooked up.
It's gonna be sick. It's gonna be sick.
I don't know. Hey guys, what's going on? It's Friday morning, so I'm doing a bit of work from home. So I'm just going through some lecture content, then I had some breakfast, and then probably do a bit more work, and then later on I'll go to the hospital for a supervision. But I should probably continue the work now. After I set the Ultradian study timer, I worked through my Anki cards trying to recall all the differentials and writing them down. I also did some OSCE practice before our supervision. The sun decided to show up after a while, so I went on my obligatory run. Hey guys, just finished doing a 5k run, like to make use of the sun, I guess, before the clouds roll in for the next week or so. And yeah, I really enjoy these mid-afternoon runs because I find them really energizing. So I'm just having some dinner in the hospital canteen. We just had a clinical supervision, so this is bedside teaching with our clinical supervisor. So we go see a patient, do the examination history, then we get a debrief and we try to figure out what's going on. So we saw a patient with a pneumothorax, which is basically when the lung kind of collapses on itself and air gets in between the chest wall and the lung. So it's pretty interesting. We saw like the chest drain and we took a good history from the person as well. So that was interesting, and now I'm eating because I'm going to go to the skills lab just to practice some skills because next week I think I have an assessment. Our skills lab is open 24/7, but I was the only one there that evening. Here's some random stuff I did, like drawing up a flush and practicing cannulation. This is quite cool. So they've left the demonstration camera on, so you can see there's a camera in the ceiling, and it's connected to this demonstration table. So if I put my hand there, you can see it coming on the screen. It's pretty cool. This is me practicing organizing a sterile field. All the white paper you see there is sterile, so you can't touch it. So it's important to practice this procedure carefully. Alright, test. So I'm just going to put the local anesthetic in now. Might feel a bit stingy at first, and then it should go numb. Sometimes people ask me what specialty I want to do, but as you can see from this, it's probably not surgery. I also had a go at fundoscopy. To testers, they put words at the back of these eyes, which you're supposed to find along the blood vessels. It's completely empty. The lights go off after a while because they're motion sensor, and it's just completely dark in this building. The next day, I had a Christian Medical Fellowship meeting, and I was leading a Bible study in the Book of Ruth. Afterwards, I messed around a bit in the market. There was also this Harry Potter shop which had some really nice chess sets. When I got back, I did the usual stuff like work and then going to the gym. I'm quite proud of my progress as now I can actually do some pull-ups, whereas when I started I couldn't even do one. In the evening, I had a formal at Robinson College. After dinner, we hung out at the MCR, which stands for the Middle Common Room. On Sunday, I had a calm start to the morning, getting my morning light exposure in the park. This is me doing a work session in the Central Library because I had an eye test that afternoon. Hey guys, so I just had the eye test and it was quite long in that I need to come back for a retest, so that shows how bad my vision is. Now I'm getting really confused looking at like what different glasses to get because I can't actually see when I put on the test glasses because my power is so high. So I'm gonna try call my mom on FaceTime to give some advice. The problem is I only have like 3% battery left, so we're gonna have to roll the punches there. That's pretty much it for this installment of the vlog. If you liked it, please consider subscribing to the channel for more vlogs like this in the future. But anyway, take care and bye for now.